Welcome to You're Not Crazy, It's Perimenopause. If you're a woman over 40 and feeling more anxious, not sleeping well, or disconnected from your body, this podcast is for you. I'm your host, Jenny Smith, functional medicine health coach, here to help you understand what the heck is happening in perimenopause. Each week, we're diving into real-life conversations about how our changing hormones impact anxiety, sleep, and stress, and I'll share simple strategies to help you feel normal again. So grab a cup of tea or beverage of choice, get comfy, and let's dive in. Welcome back to You're Not Crazy, It's Perimenopause. Today we are talking about an important topic that I've been asked about quite a bit. Cholesterol is one of those things that I think is often misunderstood. For many of us, we go to the doctor, we have our annual blood work done, and we're told our cholesterol is either good or high. Maybe we're shown our total cholesterol, LDL, and HDL numbers, but we don't always understand what those numbers actually mean or what they tell us about our heart health. And then we hit perimenopause and menopause, and suddenly those numbers may start creeping up, even if we haven't drastically changed the way that we're eating or living. So why does that happen? Is high cholesterol automatically a sign that we're at greater risk of heart disease? Is a basic cholesterol panel really giving us the whole picture? And if our cholesterol is high, does that automatically mean medication is the next step? That is exactly what we're going to talk about today. I am so excited to have Dr. Joanna Barrette joining me to help us better understand cholesterol, why it can change during this phase of life, what we should actually be paying attention to, and what we can do to better support our cardiovascular health as we get older. So let me introduce to you Dr. Joanna. Dr. Joanna Barrette is a naturopathic doctor who believes your body is always giving you information. Rather than just managing symptoms, Dr. Joanna looks at the bigger picture to understand what may be driving them in the first place. Her work is primarily focused on helping people with atrial fibrillation to move past the idea that their only option is to manage their symptoms and accept them as part of life. Dr. Joanna uses a whole person approach to naturally help people stop chasing symptoms and start addressing the root causes. Welcome, Dr. Joanna. I'm so excited that you're here today and to have this conversation.
Thanks, Jenny. I appreciate you inviting me to talk about this. I feel like it's such an important topic to talk about, so I'm so excited.
Yeah, it's very confusing. I get questions about it all the time, and I understand the basics of it, but it's complex. And so I'm really excited that you're here to kind of simplify it for us and make it easier to understand as we get those lab panels back from our doctors. But first, before we dive into all that fun stuff, tell us about you and what led you into naturopathic medicine.
Yeah, well, I was just fascinated that the whole body is connected. Everything works together. And a lot of times people kind of look at the body as this segmented thing. And so, you go to one doctor for one thing and another doctor for another thing and another doctor for something different. And it seems like all these systems of the body are just so individual. But the cool thing is that everything works together. And so when I started looking at the body in that way, it just made me dig deeper and deeper and deeper. And so over the years, I've started working with people with a variety of health concerns. And I kept seeing this common trend that people were diagnosed with something. It could be anything, random things. And then they were just given a prescription and said, here, do this. And then they were sent on their way. But they weren't giving these answers that they were really asking, which was, what's causing this? Like, why is this happening? And why is it happening now? And so that's really what kind of got me into naturopathy. But I have a focus of AFib. And the thing that got me there is it started with my dad. So my dad had a heart attack and he saw the cardiologist. And the cardiologist gave him a list of things to do. And he did everything that the cardiologist had recommended. He went to his appointments, he took his medications, but the thing was that he ended up passing away from another heart attack. And the day before he passed away, he had an appointment with the cardiologist, and the cardiologist told him that his heart had improved. So I was really confused about that. And I remember talking to his cardiologist after and asking, like, was he telling me the truth? Did his heart really improve? And was he doing everything that you had recommended? And the cardiologist told me that he was, and the cardiologist was shocked. He couldn't explain why that had happened. And that really stuck with me. And the thing that I kept coming back to was, if he had done everything right, then what was missing? Like, what was being missed that was this overall picture of what his health was actually looking like? And just looking at the heart and saying, oh, it's improving, but something bigger was at play. Mm-hmm. So my dad's story was what kind of led me down that path of AFib and really cardiovascular health.
Yeah, thank you so much for sharing. You and I have a similar story in that our parents experienced. So my dad passed away from a heart attack, but his heart attack was a result of kidney failure. And same thing with him. The doctors were managing symptoms and keeping blood sugar stable, right? But not getting to the root cause. I think it's terrible that we lost our parents, especially young, to what we both understand that could have been preventable. And with the doctors not conventional medicine, and I think, you and I align so well in that we truly do believe that the whole body works together and that the symptoms are telling us something that's deeper, but we often don't get those answers when we go to the doctors because they're specialists and they only specialize in heart or they only specialize in endocrinology or gastroenterology. We as practitioners know that it's the whole body is connected and finding out the root of that. So in my knowing you, and you and I have known each other for a few years now, through Sean Miner, our business coach, I've met wonderful, wonderful people in the program. Thank you, Sean. You specialize in AFib. What does AFib really mean? Like, what is that? In the beginning, when you had talked about it, I was like, what is that? What does that mean? And I hear about it all the time.
So AFib is the upper part of the heart is called the atria. And what happens with AFib is that part of the heart starts pumping in an irregular pattern. So it can cause the blood to start pooling and then cause all these other cascade of health issues. But the main thing is that the heart works as a whole and the body works as a whole. So everything contributes to AFib, and it's not just this one thing of, oh, my atria is not pumping the way that it should.
Mm-hmm. Yeah. So I know we're going to talk about cholesterol, but I have some other questions about that. So what is the go-to symptom treatment or the management of AFib for most people who go to their heart doctor?
So a lot of times people are prescribed medications, and then a lot of them are recommended to have what's called an ablation. And an ablation kind of stops the electrical signaling in the heart. It's a surgical procedure that people undergo. But the crazy thing, and this is why I see a lot of people, is they've done the medication and they've done the surgery and they are still having AFib happen. And a lot of times people will go into AFib and their heart will correct itself. But sometimes they can't correct, and then they have to get a cardioversion to have that, their heart start beating properly. But then that just sets for a whole cascade of other things. Because even with the ablation and the medication, their heart can still go into AFib. And that's when they get frustrated, because I have some people that come to me that have had 2 ablations and they've been on medication and they're like, I'm still having AFib every single day. And I don't know why. I keep doing what the cardiologist is telling me to do, but I keep going into AFib. Mm-hmm. And it's scary for them. It makes them feel like they can't live life. Yeah. Because they don't know when that AFib episode is going to come. So they kind of hold off on doing things. I have one guy that he wants to go on a cruise, but he can't go on a cruise because he's afraid that he's going to go into AFib and that he's not going to be able to go to the hospital. And it's just not a good way to live.
Yeah. So when somebody's having an AFib episode, does it feel like a panic attack or like a heart attack? Like, is that what people are experiencing?
It feels like your heart is kind of beating out of its chest.
Mm.
I see a lot of people that will have a panic attack and that will send them into an AFib episode. So
Yeah.
they feel like they get extremely tired. They have a really long time of recovery afterward, but it's a very hard thing, physically and emotionally, because they just are not really able to explain to other people the emotional toll that it takes on their body as well.
Oh, yeah. I can only imagine how scary those episodes can feel for somebody, especially if they don't know what it is at first before they're even diagnosed with it.
Yeah, a lot of people will have like flutters. They can feel their heart is fluttering, but they don't know if that's just a random thing or if it's actually the start of AFib. So a lot of people will just ignore it and be like, oh, my heart it felt a little bit funny, but
Yeah.
it's not until it happens a couple of times and then it doesn't go back to the way that it should that people are like, okay, something serious is actually happening.
Mm-hmm. Yeah. So your approach is different from, let's say, the conventional cardiologist. When you're working with somebody with AFib, what is the approach you take with a patient?
Yeah, I look at the root cause. So I will take a step back and I look to see what actually is contributing to this. Is it, blood sugar imbalances? Is it hormonal dysfunction? Is it, a toxic burden that's just too much? There can be so many things that can contribute to the body not being in balance. And the heart is one of those areas that starts to show when your body has some dysregulation in it. So I look for the root of what's going on to try to figure out, okay, what is causing this, and having the body show this symptom in the heart.
Yeah. And it sounds like it's not just one thing. Everyone is different on what would be contributing to that. And I work part-time for a digital health company and supporting caregivers. And I talk to a lot of people who are living with AFib. And it's not something that I've heard about just in my interactions with people I know or clients or past clients that I've worked with. But it seems with this company that I'm working with, it seems like a lot of people have AFib. And so it might be more common in older folks, but you had mentioned that you have a patient who's very young living with this. So it could happen at all ages. It's not necessarily as you get older, but I can understand like why it would happen if you get older, if you have all these things kind of building up with lifestyle and not addressing the root foundation of it.
Yeah. So it used to be what was considered like an older age condition, but lately it's happening earlier and earlier and earlier. I have people as young as 25 that are dealing with AFib, but I think this kind of goes back a little step further of the toxic burden that people are under now is so much higher now than what it used to be. So I feel like this is part of the reason why we're seeing AFib in younger people, because they've got such a large toxic burden.
Yeah, for sure. Well, let's talk about cholesterol, and I'm sure cholesterol has a lot to do with AFib. And my audience in particular are women who are in perimenopause, entering into menopause, and they're noticing like, hey, my cholesterol is increasing, but nothing has changed. And that's scary. What's happening? So can we start off with like, what exactly is cholesterol, the basics of it? And then we can move into why it increases in perimenopause and menopause.
Yeah, and I love this question because cholesterol typically gets a bad rap. It's like, cholesterol is not the enemy, though. It's actually something that your body needs. It's a waxy, fat-like substance that your body uses to make the hormones. And that's why it's so important in perimenopause and menopause. But it also builds cellular membranes, and it produces things like vitamin D and bile acids. So cholesterol is usually talked about in terms of cholesterol, HDL, LDL, and triglycerides. But I do want to say that HDL cholesterol is typically referred to as like the good cholesterol because it carries excess cholesterol back to the liver. And the thing is that LDL is usually called the bad cholesterol. But the LDL is what repairs and rebuilds, and it takes cholesterol to the brain. And we'll talk about that in a little bit because it's so important, especially in perimenopause. But the problem, I think, is that we take this really complex system and we reduce it back to like this number of like, hey, your cholesterol is high. So when I look at cardiovascular health, I want to see the bigger picture. So we want to look at the LDL, the HDL, the triglycerides, but there are also other markers that give us information about what's going on in the cardiovascular system that basic lipid panel just doesn't show us. Mm-hmm. So if you're interested, I can go on and tell that. I just don't want to I can get a little bit nerdy with this stuff.
No, and I love that because for me, what I hear is from women, they go to the doctor and they are told to take a statin because their total cholesterol is high. And it happened to a family member of mine recently where they were told you should be put on a statin because your total cholesterol is high, your LDL is high. And I asked this person, did the doctor look at particle size? Because I only recently learned about particle size when I was working with a functional medicine doctor because they dig a little bit deeper. And I think what you share is that you do broader tests to understand what does all this mean? Because I think those, like you said, the total cholesterol, LDL, HDL, triglycerides, that is only a snapshot. There's so many other tests that need to be done to see, well, how is it all playing together? So yeah, definitely go into it a little bit more and simplify it because it can be complex. If you can, as far as like just explaining why it's not, I love how you said that cholesterol is not bad because we need it. Mm-hmm. And if we're only looking at total cholesterol and we're trying to get that number down, well, that's not, that shouldn't be the focal point. It's the bigger picture of all of that's at play with cholesterol.
Yeah, exactly. So a couple of other labs that I like to look at when I'm looking at the cardiovascular system, there are really two that I really find interesting that most people don't run. And it's apolipoprotein beta and lipoprotein alpha. So apolipoprotein beta, it gives us information about the number of atherogenic particles circulating in the blood. And I know that sounds like, what in the world is that? But that's the body's ability to create atherosclerosis. So the important thing is because the LDL cholesterol tells us the amount of cholesterol being carried, the apolipoprotein beta gives us more information about the number of particles that can contribute to the plaque formation. And so that's an important marker to actually look at. The other one that I mentioned, the lipoprotein alpha, is more of like a genetically determined marker. That can give us a clue about cardiovascular risk. But I do want to say if somebody has that showing up on their labs, it's not a telltale sign that they will develop cardiovascular disease. It shows us that their genetic makeup has a tendency towards something, mm-hmm. and there are always things that you can do to influence it. It's like a light switch. Like the light switch is there, that's your genetic marker, but you've got the ability to turn it on or turn it off based on what you do.
Mm-hmm. Yeah. So going back, so is it also referred to, because I hear this all the time, APO little a, APO little b?
Yep.
Right? Because you might hear your doctor say that. And you said atherosclerosis. What'd you say?
Atherosclerosis, okay. Yes.
What does that mean?
Yeah, that's when your arteries start to become harder. They kind of lose that flexibility and they don't allow for the arteries to kind of flex. Mm-hmm. And so when that happens, it really causes a lot more strain on your heart because your heart has to pump a little bit harder because it's not expanding and contracting.
Yeah. What contributes to that, would you say, with people who tend to develop that?
There are so many factors that play into what can cause that. A lot of it, I go back, I feel like the diet really influences the majority of how people function. So I really go back to the diet and look to see how a person is eating.
Mm-hmm. Yeah. That's super important. So for me personally, I have had issues with my APOB. Am I saying that right? APOB being high, on the high side. And a lot of, I think of my personal reasons for that going up is I think the saturated fat. So I know that there's like some myths about saturated fat being bad for us. Well, I think because we're all individual, it depends, right? So for me, I think my genetic makeup has a really hard time processing more of the saturated fats. And my functional medicine doctor was like, okay, we got to get this number down. It's high. And let's try cutting back on the red meat, the butter, the coconut oil, the saturated fats that could potentially be contributing to this. Because I think sugar can also contribute to that too. And I don't eat a lot of sugar. I eat sugar, but not a lot of it. So it's kind of an experiment where I took some time to really cut back on the red meat. And once you know, that number went down.
It's so interesting, isn't
Yeah.
it? And it just goes to show you that everything plays a part and it all contributes to everything else.
Yeah. And it's different. So I've done a lot of research and reading, and I thought, red meat is not bad for us. All of those things, like butter's not bad for us, and it's not. But some people are designed to need less of that kind of food. Otherwise, it's going to show up in our body in this way. And I think that's why the basic lipid panel isn't enough. Because if we're just looking at those 4 markers, you said, the total, the LDL, the HDL, the triglycerides, then we're not getting the full picture of what the cholesterol is actually doing in our body. And we hear often the HDL to LDL ratio. Are you able to explain what that means? Like if doctors are doing that, and if we should look for that?
Absolutely. I look for that value on every lab that I request, but it does show us particle size, which you had mentioned before. So that marker there can really be helpful for telling the particle size and to see. So the bigger the particle size, the more likely that it can get caught in the arteries. And the smaller the particle size, the easier it is to travel through. So it's an important number to look at.
Yeah. Yeah.
I do want to ask you, though, with your labs and how you had just mentioned that they did that, did they also check the CRP levels for you?
Yes.
Yeah, I had a feeling because that is another one that I was going to talk about because it is so important to know with inflammation. That marker gives us another piece of the story there, and it can help us to see if there's systemic inflammation, but that also the high sensitivity CRP, that one can show us more of like a cardiovascular risk to see, because when there's inflammation, especially around the heart, it can really contribute to the cardiovascular dysfunction.
Yeah. And I've noticed that it seems that more doctors, like allopathic doctors, are running that lab marker, which is good. And I think that's great that they're doing that, because when I first started seeing a functional medicine doctor, that was the first time I had that lab run. And so the HSCRP stands for C-reactive protein. And we want that value to be 1 or less, right? Under 1 is the ideal. Yeah. So it was elevated for me. Can you share if stress is a part of that number? Like, would stress elevate that number?
Yeah. So what happens, and stop me if I get too, if I go off on a tangent too much, but what happens is when your body is under stress, your cortisol levels rise. And the interesting thing is that I see when people have high stress, they have elevated glucose levels and even A1C levels. And this is because when your cortisol levels increase, your body actually uses sugar to bring down that cortisol level. So you tend to crave more sugars. But the thing is that sugars lead to more inflammation. So it's this full cycle of your stress levels go up, you eat more sugar, you create more inflammation in your body. So indirectly, yes, the stress influences inflammation in the body.
Yeah. I talk on this podcast quite a bit about me being a stress eater. And when I'm stressed, I tend to eat more sugar. And that number was higher on my most recent test. So I think that's the beauty of having those labs is to see it in real time, like, okay, this is what's happening with your behaviors and your habits. And what can we do to just work on getting those numbers at a safe level? And we want to take this seriously because heart disease is the number one killer of women. I think that's still the same stat, like that heart disease is the number one killer of women. And oftentimes it's silent. We don't realize what's happening until it's too late, or we have that episode, or, because we're not getting the full labs done in order to change it. To bring those numbers down. And oftentimes when we do see a doctor, and this is no shade on doctors, they are doing what they're trained to do. They're managing symptoms, and they're working on getting those numbers down, because according to this chart, you're at this number, so we got to put you on a statin to get those numbers down. Well, what Dr. Joanna and I are saying is that oftentimes we're not getting to the root cause of those numbers. And that usually means starting with your diet, looking at your diet. How much sugar are you eating? How much ultra processed foods are you eating? How often are you eating? What is your toxic load? All of those things play a part in our overall heart health. And so when we think about who's at risk for cardiovascular disease, well, it's all of us. And then there are some people who have a genetic disposition to it. Do you believe that? Do you believe that some people are at higher risk for heart disease because it's in their genes?
I do. But like I said before, I don't believe that is an end all be all. You can do things to influence your outcome.
Mm-hmm. Yeah.
But it's really cool. And I love what you do with the perimenopause and menopause, because especially when we're talking about cholesterol, perimenopause and menopause really do change our body's reaction to cholesterol.
Yeah. What do you think it is about perimenopause? Is it that our estrogen starts to decline, that we start to develop higher cholesterol? Like, what is it exactly that makes our cholesterol go a little wonky than it normally is, and we haven't changed anything?
Yeah, it is a lot of times the estrogen that changes in perimenopause. And so estrogen affects throughout the body. It has a lot of different things that it does, but it really affects the lipid metabolism and the overall cardiovascular system. So when estrogen declines in perimenopause, we can start to see changes in cholesterol and the cardiovascular risk factors. So I don't typically want people to hear like, oh, you've got high cholesterol, and to just chalk it up to being like, oh, it's just my hormones. And then people dismiss it quickly, because when hormones start to change, a lot of other things are happening in a woman's body. And it's things like sleeping poorly. They start to lose muscle mass. They become more insulin resistant. They start to gain that abdominal weight. They start to experience more stress. Sometimes they become less active. And then all of those things also can contribute to an increase in inflammation.
Yeah.
So a lot of times when people start to get to that perimenopause and menopause, it's a good time to start looking at the cardiovascular system, because it's not that menopause can create heart disease. It's that all these other factors are happening as well. But the thing is that those factors, when they start to change, people don't typically pay attention to them until it's like overwhelmingly like in your face, like, hey, pay attention to me.
Yeah.
So it's important to look at earlier.
I really love how you shared that it's not just the hormones declining. We can't just blame it on our hormones. And I say that all the time with people who are interested in starting hormone replacement therapy, which I am a big advocate for. It has helped me so much. But I don't think we should start there. I think we need to start with our lifestyle and looking at our lifestyle. And you shared so much there about sleep, and we're not sleeping well because our progesterone is like dipped and it's keeping us up at night, and we're dealing with more anxiety than we're used to. We're continuing on with our same diet of eating all day, or not eating enough protein. And women over 35, we start to lose more muscle. We start to lose muscle quickly if we don't preserve it. So it's looking at the big picture of our lifestyle, which is what I talk about all the time here with the 4 pillars, making sure we have our nutrition dialed in. I think that's a great place to start. Focusing on your sleep, managing your stress, moving your body, and not just moving your body, but lifting weights and building muscle, because that is what's going to keep us metabolically healthy. And when we talk about metabolic health, we're talking about healthy cholesterol, healthy blood sugar, healthy blood pressure, all those things, right? And that begins to change as we get older. And people say, getting older is a bitch and I don't want to get older. Well, it doesn't have to be. We just have to really be intentional about how we care for our body in this season of life.
Mm-hmm. Yeah, you're so right about that.
Mm-hmm. So why, if somebody goes to their doctor, because not very many people are going to naturopathic doctors or functional medicine doctors. When they go to their doctor and they tell them, like, for example, my aunt came to me and she said, my doctor wants to put me on a statin because my total cholesterol is at 6%, whatever. Why is that? Why is statins the go-to for so many people? And what should women be aware of when they're offered a statin? What should they consider before they start taking a statin? Are you able to share more about that?
Yeah, a lot of times. So conventional medicine has become very focused on the number and not looking at the whole person. So people that have significant cardiovascular risk can benefit from a statin, but I think really that they're overprescribed. And the thing that concerns me is when people see that number on their labs and say, oh, your cholesterol is high, here's this medication and take it. They don't really look at anything other than that. So the main goal of the statin is to lower that LDL cholesterol. And then they go and they take that medication, they come back for repeat labs, and then they see, oh, that number went down. That's great. Now continue to take that medication. So it's this lifelong cycle that they've just started, but they don't kind of take a step back and say, hey, why was that number elevated in the first place? So the thing to watch out for in perimenopause and menopausal women is that statins actually can cause liver damage. And the tie-in here is that the liver is the primary organ that's responsible for metabolizing estrogen. So liver dysfunction impairs the body's ability to metabolize estrogen. And that's really important in perimenopause. Statins also, they lower that LDL cholesterol, which can contribute to things like dementia and Alzheimer's and even memory loss.
That's so interesting that you put it that way, because I never realized that it was the LDL that was protecting our brain. I thought the statins, because I've heard the side effects of statins are memory issues, low libido, joint pain, insulin resistance, like all the things that contribute to so many health issues. And it's like, well, we're putting people on a drug to protect their body, but then it's causing all these other issues.
It's really interesting because the LDL brings cholesterol to the brain. It's like brain food. And a lot of people going through perimenopause are already dealing with brain fog. And so you don't want to make that worse.
Mm-hmm. I love that you shared too that the liver, how it impacts the liver, it impacts the other organ that's so responsible for us to metabolize estrogen and to get the estrogen out of the body. Because are you able to say why we want to detox the estrogen?
So it's so complex, but your body processes estrogen, and what happens is when you have the estrogen build up, it can cause a whole host of other health effects. Mm-hmm. I'm sure you're familiar with the Dutch test.
Yes.
I don't have a copy here with me right now, but that test is amazing because it shows you how you are metabolizing estrogen and if you're pushing it towards, estradiol, or how you're metabolizing it.
Yeah.
And it's just so important because if you have excess estrogen, you can have so many different health effects. Mm-hmm. It's interesting because people will either categorize, certain things like for cholesterol, for example, will say, oh, my cholesterol is high. And it's the same thing with estrogen too. People will be like, oh, my estrogen is low. But either way, if it's high or low, you still have certain effects that happen.
Mm-hmm. So interesting. I had a Dutch test done a years ago. Actually, it's been a while since I've had one. And I think that that is a wonderful test for anyone who really wants to understand their hormones and what's happening. I have cautioned clients in the past when they're on weight loss journey to make sure that they are supporting their body, that they're not losing weight too quickly, because that releases estrogen from the fat cells, right? And that could cause so many negative side effects. And so that's why we want to do low and slow weight loss, so that we're able to detox the estrogen. And one of the ways that we do that is by going poop every day, making sure that we are detoxing the excess hormones. And so that could be an issue. And I know that we have talked a lot about hormones and cholesterol, and it's a lot to understand how it just is a reminder of how our body is complex, but it responds really well to the basics, to the basics of lifestyle. And what I want to kind of go back to what you said, Dr. Joanna, about when we enter perimenopause, so many things begin to happen. And one of the things I talk about a lot on this podcast is that women, we tend to just keep trucking along as if everything is fine, as if we're in our 20s and 30s, and that we can still have these days where we're getting up at 6 and we're just going full blown until we go to bed at 10. And we need to really take some time to schedule in calm breaks, to schedule in quiet time, because our body is really asking for that. So when things are happening in our bodies that are showing up with high cholesterol, high blood pressure, high blood sugar, you got to take a step back and say, what is happening? What is going on where I need to either slow down and listen? Because so often, right, we don't listen to what our body is trying to say. Yeah. Because so many of our patients and clients, when they get a diagnosis, they think back, oh yeah, I started feeling this way back then, but I just ignored it and just kept going along.
Yeah. It's a lot easier to ignore things until they force you to stop. A lot of women that I hear from, they put themselves last. So it's their kids, it's their husbands, their parents, and everybody that they're trying to care for comes before them. And their bodies get to this point where it forces them to pay attention and actually listen. But it's so much harder to try to correct things once it gets to that point. So it's really important to start looking at these signs and saying, okay, this is not how it used to be. I really should pay attention and do things a little bit differently instead of waiting.
Yeah. So many of us don't do preventative care. It's so much is reactive to the symptoms. And I think it's really important, ladies, if you're listening and you're dealing with anything right now that it seems abnormal, that's not something that you're used to really look to finding a provider, a practitioner who will support you in looking at the root cause of that. And really starting with like what we talked about is the basics, just going back to the basics. And the basics doesn't mean cutting out eggs and butter, right? So maybe we could talk about some of the myths of cholesterol that I think it's starting to become more common knowledge now, where people are thinking like the whole low fat craze. I think people are waking up to that was a really bad idea. That really did us in and caused a lot of problems. And now people are really realizing that, okay, eggs aren't terrible for us. Butter's not terrible for us. So what do you think some of the cholesterol myths are that are out there that people are still practicing that they really don't need to be stressing out over?
Yes. So like you said, eggs, they do contain cholesterol, but like I said before, we need cholesterol for our brain to function. And that's one of the things about these low fat diets is that you starve your brain from its food. So the cholesterol is brain food, but the interesting thing is that cholesterol is 80% glucose and only 20% fat. So honestly, I think it's very important to look at what you're eating. So it's easy to say like eggs and butter are bad, but the more important thing is like, what are you eating with those eggs? What are you eating with that butter? Are you putting butter on pasta? Are you putting butter on bread. So the pasta and the breads are carbs. They break down into sugars. So if you're pushing your body into having too much sugar, it's not actually the butter and it's not actually the eggs. It's what you're eating with that.
Yeah. Oh my gosh, such a good point. Yes.
It's so, and this is why, when we talk, we always say like the diet, it's so important to look at the whole picture and not try to just isolate this one thing.
Yeah. Yeah. It's, nutrition is, I would say nutrition is key. Now, if somebody were diagnosed with, let's say, high cholesterol, is that something that you tend to start your patients on? Is it nutrition first, or do you look at them and say, okay, these are the areas we can improve. What would be the easiest place to start for you? Or do you really prioritize the nutrition with your patient?
Yeah, I will say it really depends on a person's labs and their symptoms. So I look at labs and symptoms and kind of get a full picture of what's going on. So it really depends on what both of those are looking at. But we definitely start working on the diet. And we also supplement for certain areas that, may need support that contribute to cardiovascular health. But the diet is such an important factor. And like you said, you don't just focus on cutting cholesterol. You want to focus on eating more real, minimally processed foods. So you want to get plenty of veggies, fiber, protein, healthy fats, the foods that actually support a good blood sugar response. So it's really important to minimize those ultra processed foods, the high refined carbs, the added sugars, because all of those contribute to metabolic dysfunction and really contribute to inflammation in the body. So one of the diets that have been really highly studied when you're talking about cardiovascular health is the Mediterranean diet. And I think that that's a very good diet for people to follow so that they can get better cardiovascular health. But like you said too, and I don't know if you've said it during our time together, but I've heard you say it in the past, is that women, especially in perimenopause, need to get enough protein. That's such a huge thing. And the interesting thing, I don't know if you've talked about this before or not, is that when women are not getting enough protein, a lot of times they show up as hot flashes when people are going through menopause.
No, I don't think I've made that correlation with the protein and hot flashes. But I do think that hot flashes are a result of poor metabolic health, like something's going on metabolically. So that's very interesting. See, ladies, more reason to get your protein in.
Yes, it's so important. It's so important.
Yeah. And I love how you shared about the Mediterranean diet. What is it about the Mediterranean diet? Is it because it's mostly fruits and vegetables, olive oil? Like olive oil is supposed to be really good for the heart, right?
It is. The Mediterranean diet really focuses on minimally processed foods, a diet that's not high in red meat. It's got more of the omegas because it's got more of a tendency towards fish as protein. So it really helps with the cardiovascular health because those omegas are really important.
Yeah. Yes, I do think that the Mediterranean diet is great for so many people. I mean, like you said, the studies are there to prove that it's great for overall health. And I, for the most part, I teach the balanced plate method in my programs. And so it's essentially getting the 30 grams minimum. Sometimes we need more, a protein, getting enough fiber, and the fibers foods from the fruits and vegetables, as well as like some starches. And it's all from whole foods. So that is typically what I guide women through, which is very similar to, I would say, the Mediterranean diet. But I love that you talked about less red meat, because for me, my cholesterol is showing, hey, you don't do well on the saturated fats and you need to cut back on those. So that's why I think it's important to know that we're all individual and to really work with a provider that can look at you based on your labs and your lifestyle and go from there. So how do women find you, you work with men and women?
I do.
You work with both men and women. So how do your patients, how can they find you and how do they work with you?
Yeah, Yeah. So when people come to me, they can find me on my website at healingleafhealthcenter.com. And from there, I have a little questionnaire, and then I like to kind of see what's going on, what people are needing help with. And then I schedule a call to talk with them to see if I'm the best fit to help them, or if I can recommend another path for them to go.
Okay. So are you an in-person practice or is it virtual?
I have both.
Okay.
Both, but I can also be found on Instagram, and I just recently started a YouTube channel.
Yay.
So,
Do you have a name for the YouTube channel?
yeah, it is Healing Leaf Health Center.
Okay. Yeah. I'll make sure that we include all the links below to your Instagram, to your YouTube, and to your website. Is there anything else that you want to share that we didn't talk about? I know we covered a lot of information, and I appreciate you so much for coming on and sharing your expertise with us, because this is a complex topic and you helped simplify it. So I really appreciate you coming on. Is there any last words that you would like to leave for my audience today?
Yeah, so the thing that I would love to give your audience is just really 3 things that they can start doing to reduce the cardiovascular risk. And those 3 things, if it's, just these, would really help. It's just to take like a 10-minute walk after eating, just to get your body moving. Build your meals around protein and fiber instead of those refined carbs, and prioritize getting good quality, consistent sleep. So those things are very, very simple things that they can do, but they can make such a difference long term.
Yeah, I've talked about that before with after meals doing like a 10-minute walk. And sometimes, like with the weather, I live in Arizona and sometimes it's hot and I just don't feel like getting sweaty. So I will do squats or I'll play with my dog. It's anything just to get the heart rate up, right? To keep the blood sugar stable after a meal.
Exactly.
Yeah.
Yeah. And sometimes I will just go and sit on my vibration plate or stand on my vibration plate, just I'm getting movement as well.
Yeah. It doesn't have to be, it's just getting, what we want to avoid is going and sitting on the couch, right? And watching TV.
Yes.
Yeah. And so I'm going to link my protein guide in the show notes as well, ladies, so that you have guidance on getting enough protein and making sure that you're getting that in. Okay, Dr. Joanna, you have a quiz for our listeners, right? Can you tell us more about that?
Yeah, so I have a quiz that is an AFib root cause quiz that can kind of give you a better idea of what is contributing to AFib. Now, that is extremely helpful. It's not specific to AFib though, because it can tell you any cardiovascular issue. It kind of just gets to the root cause of what this dysfunction is, and it gives you steps of what you can do to correct those.
Okay, great. I'm going to go ahead and link that in the show notes as well. I love that you have that. I think that's a great opportunity. Ladies, if you're listening to, ladies or gentlemen, I don't know if I have any male listeners, but it's a helpful quiz for anyone to take. Share it with your loved ones if you are concerned about them or they're dealing with, any of these concerning symptoms. Thank you so much, Dr. Joanna, for being here today and sharing with our listeners about cholesterol, heart disease, perimenopause, menopause, all of that. I really appreciate you.
Thank you for having me. It's always a pleasure talking with you. I love spending time with you and talking with you about all this stuff.
Same. It's fun when you can connect with somebody who understands that, who believes in similar areas of the root cause approach, the whole body works as a system, and that you are that person that somebody can go to if they want that approach to healthcare. So ladies, if you are listening and you are wanting somebody to get to the root cause of what's going on, connect with Dr. Joanna. She can see you both virtually and in person. She's in Virginia, right? What area in Virginia?
Yep, I'm by Quantico.
Okay, I don't know where that's at.
It's like Northern Virginia.
Okay, Northern Virginia. All right. We're like on opposite sides of the country.
We're completely split.
All right, ladies, thank you so much for tuning in today. I appreciate you being here. If you found this episode helpful, please share it with a friend and somebody who needs to hear this message too. And again, check out the show notes for all the links that we discussed today, and I will see you next week.